Let's talk about one of the toughest subjects imaginable. When a health crisis hits and there isn't enough to go around, how do we decide who gets life-saving care? It's a question we have to face.
Okay, picture this. An outbreak is raging. Hospitals are completely overwhelmed. There's just one ventilator left, but two patients who desperately needed to breathe. So, who decides? This isn't some hypothetical classroom question. It's a brutal reality that doctors and health systems have had to confront. The choice feels absolutely impossible, right? It can't just be a gut feeling. It has to be based on something clear, something fair.
And this goes way beyond just ventilators. We're talking about a shortage of hospital beds, of crucial medicines, even of a doctor's time and attention. This scarcity forces us to look at some of the most profound ethical dilemmas we could ever face.
And here's a perfect example of the ripple effect. When the Ebola outbreak hit, it demanded pretty much all the attention and resources. But other deadly diseases didn't just take a break. Deaths from things like malaria and HIV actually shot up because the system was just too stretched to handle everything. So you see, the choice isn't just between patient A and patient B. It can be between entire public health programs.
So what's the answer? Well, the most critical point is this. You cannot wait for the disaster to strike. The World Health Organization is really clear on this. The only way to navigate these impossible choices with any sense of fairness is to have a framework ready to go before things get bad. You have to build the fire escape before the fire starts.
So, what does that fire escape actually look like? Well, you can think of it as an ethical compass, a set of guiding principles designed to help officials and doctors make the best possible decisions when everything is falling apart. Let's take a look at what those principles are. At the very heart of this compass, there's this fundamental tension, this constant tug of war between two really big ideas, utility and equity. Now, both of those sound pretty good, don't they? But in a crisis, they can pull in completely opposite directions. And that's the central dilemma we have to figure out.
So on one side, you have utility. That's the principle that says, let's do the greatest good for the greatest number of people. So that might mean putting a huge treatment center in a packed city to save the most lives. But then, on the other side, equity steps in and asks, hey, wait a minute, what about fairness? This principle reminds us not to forget about, say, that small remote village, even if it costs more to help fewer people there. It's all about making sure the most vulnerable aren't just left behind. There's no magic formula here. Every community has to wrestle with how to balance these two.
But let's be crystal clear about what utility means here, because this is really important. It is not about deciding who is more valuable to society. The guidelines are adamant on this point. You don't give the last ventilator to a CEO over a janitor because of their job title. Utility in this context is purely focused on maximizing health outcomes, like saving the most lives or life years, and prioritizing people whose work is absolutely essential to stopping the outbreak itself.
Another really powerful idea is something called reciprocity. Think about it. We have people like doctors, nurses, and other frontline workers who are putting themselves in harm's way for all of us. This principle says that society owes them a debt. It justifies giving them priority access to things like vaccines or treatments if they get sick. It's a way of paying back the immense risk they've taken for the public good. Now, what happens to the people who can't get that ventilator or that life-saving drug? This is where human dignity becomes the absolute priority. The ethical framework is firm. No one is ever abandoned. Even if a cure isn't possible, care always is. That means providing comfort, managing pain, and making sure that every single person is treated with compassion and respect, right to the very end.
Okay, so we've got these powerful principles, but, principles on a piece of paper are pretty useless if you don't have a real system to apply them fairly on the ground. So how do you turn these big ideas into real-world actions that people can actually trust?
The WHO guidance lays out some absolutely crucial steps. First, the rules have to be applied the same way for everybody, no exceptions. Second, there has to be a process for people to appeal a decision if they think it was made unfairly. Third, the system has to be rock solid against corruption. No one gets to buy their way to the front of the line. And finally, and this one's a big one, the decision about who gets the resource should not be made by the patient's own doctor. Separating those roles helps avoid an unbearable conflict of interest and make sure the decision is made by a neutral party focused only on the ethical guidelines.
So why does all this painstaking preparation matter so much? Well, it really all comes down to trust. A public health response will succeed or fail based on public trust. If people think the system is rigged or unfair, they won't follow the rules, and the crisis will only get worse. A fair, transparent system protects our health, yes, but it also upholds our basic human dignity.
And maybe the most critical piece of this whole puzzle is that these are not decisions to be made by a few experts behind closed doors. The World Health Organization stresses that for these guidelines to have any real legitimacy, they have to be created with input from the community itself. Everyone needs to be part of the conversation before the sirens start wailing.
Which brings us to the final and maybe most important question, the one we all need to take away from this. We've seen the framework, we understand the principles, but I want you to look around. Think about your own community. Is your town, your city, your country, are we ready? Have we had these difficult conversations? Because the time to prepare for the hardest choice isn't when it's upon us. The time is now.